So the minimum requirements, well, we have standards, and I think it's very important to keep to standards. The urologists have the standards with the EAU guidelines, for example. We have the WHO, and of course some articles, and also ICCR, which is the International Collaboration on Cancer Reporting, where they tell us exactly what has to be in a report. So in a report, we have, of course, to work together once again, this time with the urologists, and they have to tell us where they do the biopsies. So, for example, what is the region of interest, whether it's a base or something else. And in this setting, then we know exactly where the localization is, and we report it. We report biopsy lengths in millimeters. We report the tumor lengths, and be aware that not everybody measures the tumor lengths in the same fashion. So there are differences. So you have to talk to your pathologist how he or she does this kind of measurement. Then, of course, we have to report the Gleason grade, the Gleason groups. We also have to say if there's Gleason grade 4, how many percentage of Gleason grade 4 is in the biopsy, because there's a difference whether you have 5% or whether you have 49% of Gleason grade 4, which changes completely the management of your patient. We have to say whether yes or no there's cribriform and intraductal carcinoma, because these items are really very important, because if patients show these kind of features, they should not be put into active surveillance. On biopsies, sometimes, it's pretty rare on biopsies, but nevertheless, sometimes it happens. We can say whether yes or no we have seen some extra prostatic extension and perineural invasion, which is not a major prognosticator, but nevertheless, it's pretty good to know whether yes or no there's high-grade PIN. This is not so important if you have invasive tumor, but it's really very important if you have just high-grade PIN, because you have a risk, an increased risk, to have a prostate carcinoma somewhere else. And of course, then we have to say also whether we do something like immunohistochemistry or whatever, especially to find, for example, some neuroendocrine markers. And one thing is very important, that in the conclusion, everybody does not do the same either. So most of the people give the highest Gleason score, which is mentioned in the report, but some only give a kind of global, which of course you can discuss. There are very many discussions, but this is kind of gray zone where we do not know very well what to do. So I give the highest, most people give the highest, but some people still do a little bit different. So be aware that talk to your pathologist, and he will tell you, she will tell you what she's really doing in detail.